Hello, lovely. How are you? How are you feeling? Okay. Would you like to talk to me about that? Okay. It's alright. It's a safe space here. Okay. Just me and you. Alright? So I'm Dr. Nicola. I am a psychiatrist. Do you know why you're here? Well, your parents and your partner are concerned about you. Right? They're concerned about your mental health and how you've been feeling and acting. Okay, so how your behaviour has been. Right? So you saw your doctor and they referred you to myself. Okay, thank you for coming to see me. It's really brave and it's the first step to a better mental health. Okay. So, do you understand why you're here? Okay. And do you understand your parents and your partner's concerns? Okay. And can you understand why your doctor is concerned? Okay. Have you noticed anything different about yourself recently? The way you're feeling, the way you're behaving, anything in particular stands out to you? Okay, have you been concerned about anything? Okay. Your doctor is very concerned, and I am here to help you. Okay? I'm not here to judge. I'm here to support you and help you. I want you to trust me, okay? And everything stays in this room. But if I am concerned about your welfare, I may need to contact the appropriate people. However, I can assist you in any way I can. Alright? And if I do need to talk to anybody, the first people I will be talking to is your parents and your partner. Okay? But you don't need to worry about any of that. I want you to just forget where you are. Okay? Just take a deep breath. Okay? With me. again. Okay, and again. Okay, breathe normally. Okay, you got some water there and some tissues there. Alright, this is your time. Please use it. Alright, I may be jotting some notes. It's nothing to worry about. It's so I don't forget. Alright, so I can remember what we've spoken about, because I see a lot of patients, so I like to recap before I see you. Okay, it's nothing to be worried about. I'm literally just writing important things down. Okay, good. So I'm just going to pop your name down, if that's okay. Good. Could you just confirm it for me? Thank you. Do you know your date of birth? Thank you. Okay, so this is our first session. I want you to be as honest and open with me as possible. Okay? The more I know, the more I can help you. Alright? Okay. So let's take a step back. Tell me, how do you feel at this exact moment? Okay, so let's have a look at those words then. Scared, confused, and intimidated. Alright. First of all, I don't want you to be intimidated. Okay, I'm here to help you, not to judge you. I'm here to support you and help make you better. I know it can be very daunting in these situations. You've kind of been dragged here and possibly you're not really aware of what's going on. All that mixed together can make you feel scared and confused. Alright, and that can also make you feel intimidated by me and the situation. So those 3 words are very good. 3 words, and I'm glad that you can recognise those emotions. Okay, but I want you to feel safe here, alright, as you are, and I want you to trust me. Okay, alright, and I know it can be quite scary, but don't let it be scary, alright? Okay. So that's how we're feeling at this moment. How have you been feeling in general recently? Okay, well, you say you're not too sure. Why is that? Why do you think that is? Okay. Okay, so you're not too sure and you thought you were okay. Makes sense. Try to go a little bit deeper, really to the heart. Think about how you've been feeling at any time, any one moment. Tell me that emotion. Yeah. Okay. So when you say sad, how did you react to that emotion? Okay. So you'd cry. And what else? Yeah. So listen to sad songs and locking yourself away. Do you know why you felt sad at those times? Okay, so you're not sure. Can you recognise any other emotion that you may have felt? So, when you say lonely, were you physically lonely? Okay, so you weren't physically lonely, but you felt lonely. Can you describe that for me? Yeah. Okay. Can you think of anything else? Okay, so empty. And what do you think that was? Okay. Are you an empty person? Are people empty? No. That's right. So you felt empty, even though you know you're not empty, but you still felt it. Okay. And you don't know why. Same with the loneliness, you don't know why. Okay. So, do all these emotions come together, or are they separately? Okay. Okay. So we can have them together or separately. Okay. That's good. That's fine. Right. Can you think of any other emotions that you feel? Just list me some off. Okay, stop that. You feel angry. Why? When you say you felt angry, why? What happened? And what happened when you felt that anger? Okay, that's good. And do you get that a lot? Okay. You say you're scared. Are you scared of something in particular? You say you feel hopeless. Why? Can you explain that to me? So you feel that there's no future for you? You can't see anything good? You feel like there's nothing good in life? And you feel that you're worthless? Yeah? Okay. And that all makes you feel depressed? Yeah. Alright. Alright, okay? Yeah? I know. It's alright. It's gonna be alright. Okay. Yeah. Make sure you use the tissue. Okay. Let's see, just let it out. Go on. You take your time. You take your time. I'm just going to jot some notes and you just let it out. Okay. Oh, don't apologise. Honestly, it's fine. That's what this room is for. Alright? But you're recognising the emotions that you're feeling, and that is overwhelming. Alright? It's actually a really brave thing that you're doing. Okay? Good. You're right for me to carry on. Okay. So you say you feel depressed. Let's focus on that. Is this all the time? And what happens? Okay. And how does that make you feel? Okay. You say you're overwhelmed. What are you overwhelmed with? Emotions. Okay. Easily. I thought you would say that, and I hoped that you would say that. By saying that, I hope you would say that, because I know that you can experience those emotions then, and I know that you are feeling it, alright, and you're understanding. Okay. So you're overwhelmed with emotion and you can't control it. Yeah. And what was that, sorry? It's suffocating. Okay, it's interesting. Okay. It's suffocating. Can you elaborate? How is it suffocating? Okay. Yes. Oh, I understand it completely. I know exactly where you're coming from. I just would like you to just tell me in your words how you feel suffocated and describe it for me. Yeah. Okay. All right. experiencing low mood, and you're either very low or low. So you're always low or very low. It's not a good or high, or it's always low. Low mood. Dull. Tired. So you're quite fatigued and lethargic. Okay. And when you say you're worried, what's worrying you? You don't know. Okay. Sense of what? Dread? Are you dreading something, or what? It's like a sense of doom, like something bad's going to happen. Okay. Is that all the time? So, does it get brought on by anything, or does it just randomly come on, or? Okay, so randomly. Okay. And what do you do to control that emotion? Okay. Okay, makes sense. So if you were to score your mood, scale of 1 to 10, 10 being the worst, where would you put your mood currently, right this second? Okay. And what about in general, over the recent weeks? Okay. I gathered that you're going to be feeling a lot of self-hate. I want to know if you're feeling any paranoia or any jealousy at all. Okay, so you'd say you're paranoid. What are you paranoid about? Everything? Anything, or something in particular? Okay. And why is that? Okay. Right. So you're quite an intelligent person. Okay. Are you aware of how you're feeling day to day? What about if I was to say to you that I think you're suffering with depression? Would you say, yeah, that kind of makes sense, or would you disagree with me? And why do you agree with me? Okay. And how come you haven't reached out for help? Yeah, I get that. Scared, and you didn't really think there was an issue, yeah? And now we're talking about things are coming to light. Alright, that's good. Glad you recognise that. Right, so let's dig a little bit deeper. Okay. I was told that you've been experiencing hallucinations. Would you like to tell me about that? Okay, so you're not really sure. Okay. So I've been told that you hear voices, you see things, and let me try to explain it to you. You hear people say things when they haven't said it. That's what I've been told, so let me try and understand this. What I think is meant by that. Say your partner has said to you, I hate you. You've gone, what did you say? You said you hate me. Then your partner goes, I never said anything. I didn't say that. I think this is how this is meant. Have you ever found yourself in that situation? Okay, so you do. Yeah, is that quite a lot? Yeah, and then you get paranoid then, and yeah, that makes sense. So you're recognising that. Okay. But you think it's real, don't you? I get that. I understand. In that situation though, why would your partner, your parents, your friends, family, whoever, why would they be out to get you? Why would they want to sabotage you and hurt you? They love you. Think about it. Do you really think that your partner has turned around and said those horrible things to you? Really? Doesn't make sense, does it? I mean, you've said that they treat you well and you're best partner and supportive family, and I can see all that. Would they really want to hurt you? They wouldn't, would they? Alright, I know. Alright. It's okay, let it out. Let it out. Alright. This happens and we start realising things, okay? Alright. Okay. Okay. Compose yourself. It's alright. Are you ready to dig deeper into this? Yeah. Would you like to explain some of the things that's been happening to you? Whether you think it's real or not. Just explain those things to me. Okay? You feel like you're ready? Good. Okay. So is it only the bad things that you hear? You don't ever hear anything positive or good? Okay, so all negative. Okay. And whose voice is that? Would you say it's your conscience? You can hear your own voice. Is it a man's voice, a female, or somebody in particular? Okay, so you don't know the voice. Okay. In male. Okay. And how does he sound? Is he scary? Normal? Okay. What kind of things does he say? Okay, so he gives you warnings. In what way? Okay, so you would say he's there to protect you. Okay. Can you give me an example? Okay. So, you're on the bus and it's quite an empty bus. Some people at the back of the bus, yeah? Then he spoke to you and told you to get off the bus. Okay. How was it said? So it was an order, an instruction. Okay, so it's get off the bus. They're laughing at you. Okay. So get off the bus. They're laughing at you. Okay, was that the first time you heard him? And how did you feel? Okay, so scared. Okay. What did you do? Okay, so you froze and tried to ignore. Alright, but it kept on. So then what did you do? So you did get off. Right, so the next bus stop. Okay, what made you trust him? Because they were laughing, okay. It's a brave thing to do though, considering you've not heard him before. But you just felt like you could trust him. Okay. Did you look at the bus as you walked past? And what were they doing? So they were laughing. Okay, so that kind of proved it to you that he was telling the truth. Okay. Do you recognise how long this has been going on? Okay, so we've got the seeing, hearing the dog, haven't we? Then you've got the voices, when it's telling you to do things. Then you're hearing people say things when they don't. Anything else? Okay, can you explain that? Okay. So you were in a shopping centre. It's very noisy and busy, okay? And you could hear everyone's conversations. Okay, so very clear. Okay, but it was all negative. So you could only hear negative things and odd words and sentences and things. Alright, okay, it's very interesting. So your senses were heightened basically. But that was very confusing for you. What happened? Yeah, I can understand that. I can see why. Okay. And that's the last time you went there. Do you wonder why these things are happening to you? Yeah. Can you see that these are hallucinations? Yeah. Because you are quite intelligent, aren't you? So I can see that it isn't real, these things that have been happening to you. And you know that, but you sort of still believe it because to you it is real and it is as you see it. I get that totally. So it's probably hard for you to hear these things, isn't it? And to understand them. Okay. Right. We've got a lot to talk about here. And a lot we could build on. I would like to know, how long have you been feeling depressed for? Okay, so that's quite a while. And it's been escalating for a very long time. Okay. I feel like you're describing what we call psychosis. Alright. Which is where all sorts of different things can happen. And hallucinations are a form and what you can have. And it's very complex, okay? And it might be hard for you to understand. Sometimes we can experience hallucinations and something called schizophrenia. Have you heard of that? Okay. So this could well be a case of schizophrenia. Or, if I'm thinking correctly, I'm thinking you've got major depression, severe level at the moment, which has been left untreated, and you have developed psychosis. Can you see how that would fit and slot in? Yeah. Okay. That's what I'm thinking. Because some of the things you have explained to me, I will like to go further into detail on them before I give you a official diagnosis. Okay. I do, we have a lot to talk about. But we need to do something. Okay. And you're not on any mental health medication, are you? So I will diagnose you with major depression. It's definitely what I think is going on. And that's causing an array of symptoms. Okay. So the emotions, the feeling, the crying, the being lethargic, fatigue, the not really eating or sleeping too much, all that kind of thing, okay. Typical depression symptoms you have got, okay. And you said you experienced a little bit of anxiety. I'm unsure whether we are talking about an anxiety disorder here at the moment, okay. I'm more concerned about the depression side of things, okay, and the anxiety is probably coming from the depression, okay. Have you been self-harming at all? What about any suicidal thoughts or behaviours? Okay, is that quite often? Alright, okay. Alright. It's okay. It's fine, let it out. I understand. Okay. Alright. Someone that's been there. I get it. I really do. Okay. Alright, so I'm unsure whether we're looking at a personality disorder as well. Okay. Question mark that. Some of the things we're speaking about, I'm just curious whether we have borderline personality disorder, or another word we tend to say now, emotionally unstable personality disorder. But the names of it don't always sit well with patients, which I can see why. But, you know, we won't go into any of that yet. Okay. And obviously the hallucinations, I'm thinking psychosis rather than schizophrenia. But what I'm going to do, I'm going to put you on some tablets, okay? And we're going to try these tablets, and I want to see what happens to these hallucinations, okay? The bad thoughts, the negativity, and all that type of thing, typical psychosis symptoms. I want to see what happens to those. Okay, so I'm going to do a prescription. Right. I'm going to give you an antipsychotic tablet. Okay, I'm going to give you a low dose of risperidone. Okay. And I want you to take that, okay? It will take a good few weeks to work, 2 to 4 weeks, okay? But eventually you'll start to feel better, but I want to assess it, okay? I'm going to give you some mirtazapine. Okay, it's going to be quite a strong dose, all right? So that's your antidepressant, okay? And I'm going to issue a few diazepam, okay? But I need you to take the diazepam when needed. So I'm going to give you 5 milligram, okay? And you can up that to 10 milligram if you need to. Okay, but that's limited supply. I'm only giving you 14 days worth of that. I'm giving you 28 days worth of that and 28 days worth of that. Good. Perfect. Okay. You need to get these ASAP. Okay. Give it to your partner or your parents, okay, to get that for you if you don't feel capable yourself. But we've got a lot of work to do, okay? We need to have a lot of chats, conversations here, if that's okay. We need to talk about the depression and what I've diagnosed you with, okay? We need to talk about all your symptoms, your experiences, okay, with them. We need to talk about more about the hallucinations. We need to talk about self-harm and suicidal thoughts, etc. Okay. We need to talk about self-esteem and image. Paranoia we need to talk about, okay. That's what comes under the symptoms, but we do need to discuss that. And obviously we need to chat about meds. And then other treatment. I want to see you a few more times. I want to be sure on diagnoses. I need to find you the right treatment. I need to know everything to make sure that you have got the right diagnosis and that I can treat you correctly. I will need you to have some therapy down the line. Okay, and we'll probably have to try and tweak different medications and see what's going on. All right. Okay. You're very welcome. I know. You feel a lot lighter now. Good. All right. Okay, so that's the plan. I'm going to see you next week. I'm going to get you a CPN, mental health nurse, all right. And I would like them to come to your house. Okay. And then I will see you weekly as well. All right, but on a different day. Just for now, I will extend when I'm seeing you, how often, etc. And then if we get the psychologist involved as well, I'll be a lot more spaced out. I'm the one that prescribes and diagnoses, and the other ones are the ones that kind of, look after you, treat you, and give you therapy and things. Okay, my love. So, I'm very happy with that. Thank you so much for opening up to me today. All right. It means a lot to me that you could speak about how you feel. All right. Your parents and your partner will be proud, and so will your doctor. Okay. All right. So, am I all right to see you next week? Good. Same time. Brilliant. Get that medication. There we go. Get this and start taking it immediately. Alright. Make a diary on how you feel and your thoughts, symptoms and things like that. And if you're unsure whether something is a hallucination or it's real, jot it down. Okay. You're very welcome. So you just take time to relax. Just clear your mind. Take time for you. You take care now.